Defibrillator surgery without interruption and anticoagulation. Defibrillator, a pacemaker definition, is that it's a medical device that uses electrical impulse delivered by electrodes contracting the heart muscles to relay the beating of the heart.
A surgeon will insert a pacemaker into your body if your heart's conduction system, the electrical system that makes your heart beat, is not working properly.
The primary purpose of a pacemaker is to maintain an adequate heart rate, either because the heart's natural pacemaker is not fast enough.
While you're in the hospital, your doctor will monitor your heart rate and blood pressure to be certain the pacemaker is working.
Applications in medicine. Doctors recommended pacemakers for many reasons. The most common reasons are bradycardia and heart block.
Usually we can gather the information we need from non-invasive studies. There's a lot of testing that we go through to determine whether or not a patient needs a pacemaker.
About diagnostic tests, EKG is a simple painless test that detects and records the heart's electrical activity. Those are electrodes. About disadvantage, once you have a pacemaker, you have to avoid close or prolonged contact with electrical devices or devices that have strong magnetic fields. Devices that can interfere with a pacemaker include cell phones, metal detectors, high-tension wires, industrial welders, etc. About physical activity, in most cases, having a pacemaker won't limit you from doing sports and exercises, including strenuous activities. Pacemaker surgery generally is safe.
Implanting a pacemaker is an invasive procedure and it does involve a small amount of risk. There are particular things that we are worried about at the time of implant. We're always concerned about infection with any invasive procedure, and therefore patients always get antibiotics before, during, and after the procedure. In addition, the procedure is done in a sterile setting in the operating room to reduce that risk of infection. There's a risk of bleeding anytime we make any incisions on the skin. That risk of bleeding is typically rather small for these kind of procedures, as the site is quite accessible and we can always hold pressure on that location and stop any bleeding quite easily. Other risks include the risk of causing a collapse of the lung with the needle that we use to access the vein. That risk is typically 1 in 300 to 1 in 500. In addition, there is a risk of causing bleeding around the heart.
Finally, about this, your doctor will want to check your pacemaker regularly. Over time, a pacemaker can stop working properly because its wire gets locked or broken, its battery gets weak or failed, your heart disease progresses, and other devices have disrupted its electrical signal.